Second time she did it from here. So I'm going to tell her to do it again from here in a second. Okay, so come up to about here and don't lift your shoulder, right here. And now internally rotate. Right? So you always want to make sure that they're doing the same thing, because she feels so good now after Mike's treatment. She's like, oh, I can go up to here and do this. So we check that first. So there's obviously some cervical spine involvement. So I could do a whole cervical spine joint involvement and I'll get a big difference on here. Okay, so let's just check if the same level. I'm about C3, 4-ish right here, C3 mostly. So I'm going to do the horizontal abduction from here and come all the way back. Any difference in what you feel? Yeah, a little more fluid. Did you guys notice that? Yes? Okay, so I'm going to do one more thing before we go. I want you to show me this side again from 9 degrees abduction. Okay, bend this and do your internal rotation. Okay, it's a little stiffer and she starts to cheat a little bit. I'm going to do this side. Bend your elbow. Do this one. Yeah, a little bit of cheating, but that's the normal cheat, right? Okay, so now I'm going to do is this. Do you want to just come this way? So I'm going to do this actively and I'm going to put a little bit of pressure at the end. So all I want you to do is stay in 9 degrees and do this. Okay, 5 times. A little crackling and grinding in the shoulder. I'll say that into Mike. Okay, take a deep breath, hold it and push a little bit further. Okay, relax. Okay, 9 degrees. Okay, now do it. Just go once. Sorry. See the difference? Okay, so there's some symmetrical stuff going on, which is a whole other thing, but it gives me an idea that if I can get this side working better, it's always the indirect. We always learn in massage school, treat the unaffected first. And as a student, we go, why? What does that do? Right? There's no way this and that's going to happen. I'm telling you, they're using it for strength training right now. Someone's got a weak muscle. They're actually strengthening the other side to build the side that's not as strong. So range of motion actually works really well on this is too. So what I'm going to do here is I'm going to do this seated for a second, and I'm going to get, after that, let's just check where we were, a little less than 9 degrees. Bend this elbow. So you want to do it all the same. Now do it. Where do you feel? What do you feel? Any different? That's all I need to know. Is it different? On the better side. Okay. Now from here, do abduction. Come right back to me. Right back. What does that feel to you before you start to cheat? Easy, right? And before you could tell it was like, ugh. Okay, so probably not a lot to do at this level, but let's just see. And all I'm doing is I'm just palpating transverse processes to see if there's a rotation going on. Actually, not bad, and I didn't really do anything yet. Awesome. Okay, right there. So what I'm going to do, I find it's a little bit rotated this way, so it's rotated to the right. Okay, it's your guy's left, but the spine's rotated to the right. So I'm just going to stabilize it, and I'm going to get her to slowly turn to the right, and I'm just going to hold the vertebrae there. Turn. Okay, stop there, go back. And I let off when she comes back, and then I stabilize again, go again. Okay, and then go back. See if that did. Sometimes it works great and seated, sometimes I got to get her to lie down. We okay for time? Oh, perfect. Okay, so here first, bend it. She's cheating a little bit, less, easier. Okay, let's go to 9 degrees. And now do it. Try not to bring your arm back. How's that feel? Okay, and then abduction, come right back to me and go a little bit more speed this time. Okay, so the only thing I would adjust on this, you guys can see the difference, right? Now what I do is I stop her from turning her body, right? Because we all want to go, yeah, I can do this, right? So now come back and I'm going to actually stabilize you right here and just do shoulder. Now what do you feel? Still looks pretty good. Yeah, it feels good and her body's not even helping now. Okay, now if I hold her here 9 degrees, okay, and I don't let her cheat at all, now do internal rotation. How are you feeling there? Yeah, big difference, right? Just for kicks, let's do abduction. Just from here and go straight up. Like the first one you did with Mike, start down here, go all the way up. Okay, a little bit like Mike got it great, and we just added to that. Do both arms at the same time, because that's what you did last time. Go right up, right up, right up, right up. Okay, so look at that. There's a little bit of stuff going on here with the scapular region, right? So there's some cheating going on. If I was just to kind of do this, stabilize the scapula a little bit, now do the same thing bilaterally. It's a little less fluid. So what does that tell me? I got to go to the scapula and the joints that are affected. So I'm actually not even going to touch the scapula because I got a minute left maybe. I would go to the thoracic spine and do the same thing and just check what's going on. Yeah, so she has some good rotation going on here, right? Which I expected. So if I just stabilize, all I'm doing is stabilizing because that tells me there's maybe some activation that needs to happen with the little intricate muscles. Now do both bilaterally. It's harder because I'm holding her. What does that do for you? Totally different, huh? Did you guys see a little bit of difference there? Right? What's happening here is I can get the little I can feel that the little air releasing, the little audible clicking that's happening, right? And all I'm doing is stabilizing right here. So that tells me I gotta do some cervical, I gotta do some upper thoracic. Okay. Now let's just check for neck range of motion because I'm pretty much out of time. Go as far as you can. Okay, better than what Mike was doing. You guys have the best angle. I had the side angle from what Mike was doing. So I want to double check. I want to build on what each other is doing, right? Better range for you, better feeling. Okay, go to the right. Different for you. Different for you guys. Yeah, and then turn to the right for me. Can you see them over there? Okay, can you see nothing over there? Go to the right again for a sec. Yeah, still a little restricted on this side, right? Yeah, because I can see her face when she turns that side, I can't. So that's, again, the same thing for me. That's like the vertebral joints going on. Because when you release the joints, the muscles are going to go along with what you're doing. Yes? Any questions? You're going to be good as new after the last two.
So, JC, nice to meet you. We talked for a second in the trade hall. So she already knows I do cupping, and we were interested in taking a look at this shoulder. We talked about it actually in the trade hall. So I love what these guys have done. It's very similar to some of the things that I would do anyway. So what is left for you? What are you feeling the most right now? Cervical. Trap. Okay, perfect. Easy peasy. So when looking from over there, it looks a lot different from you guys looking forward. So I'm going to just take a quick look. I'm just going to have you rotate to the right for me and then to the left. Okay, so very much restricted to the right. Okay, and then side bend again. Okay, and the other way. Stuck. Okay. Been practicing for a long time. What I generally notice if they're restricted both to the same side, you're looking at more of a joint problem. If they're opposites, side bending and rotation, we tend to see muscular problems. So this to me looks like a joint problem. Okay, that's fine. We still have to do the muscle work though, right? And I do cupping for a living. So I'm going to use cupping as my soft tissue intervention. Is that cool with you? Have you had cupping done? Okay, there's always the possibility that we leave awesome bruises on you. I didn't bring any of the star-shaped ones because they're not going to fit on your neck anyway. All right, so let me grab a few cups. All right, I'm going to use a variety of cups, and what I'm going to have you do is spin 180 so you're facing this way so they can see what we're doing. All right. And now we've changed sides, so I'm confused. Which is my right and which is my left again, right? So with her, all I'm gonna do is pull the shirt this far away, right? That's all I really need. I'm gonna use cups that conform really easily to what I'm working on. And this one, I'm not gonna get much higher onto her neck, because obviously she's got hair here, right? And that's just going to cause cups to pop off. So what I'm going to do is come around a little laterally. This will feel weird. right? That one didn't love me. Let's see if we can get this one to say. And because I'm going to just cover as much, I'm a big fan. I did my training originally in Chinese medicine, so we blanket cup everything. But what I like to do is add a little movement. So what I want you to do is just turn your head back and forth, just slowly, comfortably go back and forth. What am I doing here? I'm hoping that the cups aren't going to fall off. I'm going to catch them. All right, and then now what I want you to do is side bend. So head over that way, good, and just back and then forward. See the changing starting to happen? So if we add our client to do some of the movement, it's easier on us as therapists because, you know, I'm lazy, I'm inefficient. And so it gives us some break in our treatment day, but what it also does is it gets her neurological system working for herself, right? Which is exactly what Mike's done, exactly what everyone up here all weekend is going to tell us, right? So, I get them all, good? Okay, so at that point, in terms of soft tissue work, get you to turn your head now without the cups on. Okay. All right, spin around so they can see that because that looks a lot different. Right? And Brad's hiding. So the last thing that I do, so in my regular manual therapy practice, going to get you laying on your back, bring your head all the way up here. I'm going to look at some passive range of motion. I'm going to look at what joint is doing what. So this is not cupping, obviously, but it still gets into soft tissue and joint manipulation. So her, whatever vertebra this is in, is not translating at all that direction, okay? So we can block it, side bend it, and add rotation. Is this okay for you? What did you do to this poor neck? Okay, so what's going on here? Anterior muscles are really mad at you. So we're going to do a little longus coli work. We can't do this with cups because we have to be conscious of the carotid artery, etc. So we're going to slide right past it. You should be able to talk, swallow, breathe, and all that. And you can feel how tight her longus coli is, because as I friction over top of the longus coli, I'm pushing her trachea off to the side, and it feels like it's like pencils going in a pencil case, rolling over each other. And then we do the other side because felt ugly on both, and this one's worse. Good job. That was my finger, not you. Something popped. There we go. Okay, sit up, face them. Turn your head. And another way. Okay, and now side bend. Easy peasy. Not bad, right? Now, abduction of your arms. Just from straight, over your head, like touch the backs together if you can. Okay, so just that, she's not cheating into flexion like she was before. You guys could see it probably better than you guys can. when she was coming into abduction, watching from that side, this right arm was flexed forward, and the other one, I'm exaggerating, but now she's clear. So there's a lot of the restrictions coming from her neck. But that's how cupping can help you within your practice. It's not necessarily your only modality, but it sure makes the treatment a lot easier.
Good morning. I will give you kind of insights into some tools that are going to complement everything they just did. My name is Brad Norris. I work for Rock Tape. Surprise, surprise, I'm wearing a billboard. I've been with Rock Tape as their lead medical educator for approximately 12 years. I've been in the high performance environment for almost 40. I was on the Canadian bobsled team. I now serve on their medical staff, so I deal with athletes all the time. And my job, I think, with Rock Tape is really to demystify this stuff. There's a lot of information about taping and floss and all of these tools that are it's simply not true. And I want to, again, today, I just want to give you insights into how you can use these tools. It's relatively straightforward. There's some really governing principles for me, and this is with Rock Tape and with everything I do in my practice. Number one, most importantly, movement matters. I think our job as therapists is to promote pain-free ranges of motion that we can reinforce through good pattern. And I say this all the time. I teach for massage addicts. I'm one of the lead educators for them. I teach with this core of people. And the defining kind of relationship with all of the therapists is the idea that our job is to promote some type of movement parameter that's going to reinforce better joint mechanics, reduce pain. Movement is critical for us. The second thing, and I think for me what's changed, I taught for Charles Poliquin for years, and I lived in a very hardware-based environment. And the fact is, over the course of the last 10 years, I've become a nut about the neurology and the fascial system and the neurology of the system. Fascia is everything. You don't need to beat this system up to get an effect. And I'm going to show you how to use a floss band as a complement to what the other therapists have done. And I'm going to show you how to put tape on. Tape is really a reinforcement strategy. So when we use these strategies, they're subtle. No one's ever fixed a Ferrari with a sledgehammer. You don't have to beat this up to get an effect. So when I use these tools, that's the one thing I want you to embrace today, the idea that you don't have to overstretch tape. You don't have to leave floss on for extended periods of time. You can open a very, very big door with a small hinge. And that's really how I want you to perceive this. So the two tools I'm going to show you today are floss and tape. Floss is a compression strategy. And what we do with floss is wrap the joint and then motion through pattern. I'll explain it in detail when I apply the floss. And then I'm going to apply tape. And there's lots of tape companies out there, and it's a wonderful situation here. I work with Troy Levine. He and I work for separate tape companies. There's no competition. We're all speaking the same language. We're using these tools to invest in a nervous system that requires better information. Here's the piece with tape, floss, everything. As much as we'll talk about the mechanics of tissue and how I can facilitate change, the single variable that is the conduit for all of these tools, can we tap into a nervous system that requires more information? Look, if we have more sensory clarity, if we clarify the message on the way in, the nervous system will always grant us more. Better sensory in invariably means better motor out. And if there's a lack of reference or there's a muddied perception of where we are in space and where the joint is, there's a simple way that the body brings attention to the area: pain. So if all we do with these tools is assign something that's going to clarify that message and bring back some of the baseline kind of mobility that we need, we're in a good spot. I'm going to do one screen. They've already screened it. I'm just going to have, it's JC, correct? Yes. I'm just going to have her go overhead. The reason I deal with athletes on a regular basis, but I also deal with clients who require the ability to move overhead and grab something out of the cupboard. I say this all the time. Everyone's an athlete. Everyone has the same expectation. They want to move pain-free and be able to do the things that they value. So I deal with pro rugby players, and in the same day, I'll deal with my 90-year-old mother-in-law. But my perspective and my approach is essentially the same. I'm going to use all of these tools to promote a pain-free range of motion that they can then reinforce over time. So we're going to do something really simple. I'm just going to have you from that position, I'm just going to have you go overhead and press. That's improved from when we started, so that's fantastic. So if I have a pitcher and they lack that positional cue overhead, they can continue to throw all they want. They're in a flex forward position. This is a primal position. This is safe. So anytime we have someone show up with a concussion, any type of head injury, where are they? Here. We're supposed to be there. We're wired for that. It's not the best position. It's a primal position, but it's where we are. So So what we want to do is change that relative position. So when we look at shoulder issues, if I have a pitcher and they're throwing a baseball all day, if they lack the appropriate retroversion to get into a position to load, they're in this position, the midline's failing. The fact of the matter is the shoulder's doing all the work. Invariably, there's going to be a labral issue because it's pinned forward in the capsule. So overhead, I'm going to use two tools. I'm going to use a floss band first. You ever had floss on before? Okay, perfect. And you've had tape on before. Okay, so you want to talk to your patient about this and make sure you understand what's this made out of. If they have any type of latex or allergy, not appropriate. You have to have that conversation. Secondly, some people have a reaction to a Band-Aid. Reacting to tape is rare, but it happens. Generally, the reaction, I'm going to explain today why there's a reaction, people overstretch the tape. Again, I come back to what I said, you don't have to beat the system up to get an effect. So, when she comes overhead, there's a restriction, as Paul's talked about, the other therapists have talked about. There could be a tipping of the humeral head. Is it forward in the capsule? There are 4 variables that may restrict overhead pattern. Number 1, is there a legitimate change in the capsular integrity? Is it tight? Are the tissues that support the capsule super tight? That's one variable, obviously, and we're going to, therapists, work on that. But we have to look beyond that. There are other factors that effectively change our ability to get patterns overhead. Scapular function. Is that scapular system appropriate in establishing good control? And we describe them as scapular stabilizers. There's nothing stable about it. Scapular stabilizers are essentially the process by which the scapula functions is controlled mobility. The idea that it's stable is ridiculous. So what we look for is there a lack of scapular control, and we can look at the scapula position. Is there a medial winging or an anterior tipping of the scapula? In either case, those muscles aren't doing their job to allow the upward and downward rotation of the scap that's going to permit overhead carriage. Number 3, thoracic extension. I have bodybuilders come to my office and say, it's weird, I have shoulder pain. Is that weird? That shouldn't be too weird. If I see the humeral head forward, I see them in that position. If they're standing in front of me, I can see their third finger. These assessments are easy. It's pretty obvious there's a problem. And if you're concerned or you question that, go here, move overhead, drop into this position, lacking that thoracic extension, come into flexion and move. Shouldn't surprise anybody. There's an orthopedic cost of the shoulder, though, trying to force ranges of motion when we're not in the proper position and the humeral head is not centrated. So the goal of these therapeutic interventions, floss first, is to change that fascial load and change the threat. If the brain perceives threat, do you think it's going to let you move? Never. It's not supposed to. We're wired for that. And then lastly, for shoulder issues, lumbopelvic control. Every athlete that shows up with a shoulder restriction, they get midline control drills. And they say to me, I think you're nuts. It's my shoulder. If you believe that injury is as localized as that, you're going to miss a lot of opportunity. Simple. Central stability feeds distal mobility. If this foundation is strong, look, we don't build a house on a crappy foundation, it'll crumble. If that's weak, I'm not going to test it, but I would. The fact is the joints above and below, joint by joint, tells us this. Every sector of the body has a characteristic, and you alter the characteristics of one joint, you alter the characteristics of the joints above and below. Have to happen. So what we're going to do is this. I'll explain floss first. I'm good for time, guys. Sorry. Oh, I will go for 58 minutes, but okay. So you've had floss on before. Okay. Perfect. And if I go over what? No. Okay, and just relax. Floss band. So before you put it on, you're going to tell them, I'm going to wrap this. It's tight. And some people don't like this. So you might just put it on, and I've had patients say to me, don't do that again. It's rare, but it happens. The premise behind floss is simple. There's an entire core of receptors in the system that respond to compression. And if the brain perceives threat, what's the best thing I can do? Hug the tissue. Hugs are calming. The idea of hugging tissue with a band is pretty simple. But we're going to take it a step further. I'm going to show you how to externally and internally glide these tissues. Here's the theory, and here's the premise behind all of this stuff. If you follow the Fascial Congress, and I'm probably the only person that watched the entire Fascial Congress because I don't have anything better to do. But the reality is they talk at length about the fact that the superficial and deep layers of fascia, when they become densified, alter the messaging. The most dense sensory zone exists between those layers. So you have to think that over time, if that connective tissue matrix becomes bound and fixed, the clarity of the message in the way-in is faulty. The body doesn't know what to do and doesn't know where you are. The second thing is the fluid environment in which we operate. Fascia sits in this wonderfully fluid environment, and the reality is, again, over time, if there's a lack of glide and slide, there's a change in the viscosity of hyaluron. So you've got this gluey texture that's dense. It's not going to slide and glide. Really quick before I do this, the Longevin study is critical to understanding this. They looked at people with low back pain. When they did ultrasound diagnostics, almost invariably, every person with low back pain, when they looked at the thoracolumbar fascia, there was no shear point. It was fixed. And it was a correlate in every person with low back pain. It tells us everything about the health of fascia, the expression of pain, and by extension, are we going to get movement? If you're in pain and there's threat, do you think your body's going to grant you movement? And when someone says to me, I went to a therapist and they said, I have shoulder pain, do these exercises. Are you kidding me? You think you're going to override that message and change the mechanics of joints by forcing them into painful axes. It's ridiculous. It's never going to work. So we want to change the characteristics of the tissue and then reinforce it with tape and movement. It's very simple. Okay, so let me explain floss. So JC, you're just going to put your hand right there. Good. I'm going to take this floss band. Here are the rules. I shouldn't say rules, but I guess the rules. 50-50. 50% tension, 50% overlap. We work distal to proximal. Why? Anytime I have any fascial restriction, there's probably a congestive nature to that tissue. Directional. And then lastly, 2 minutes. Once I put it on, I'm going to walk you through what I would do with any athlete I have. So I'm going to set up this band. I'm going to get you to press into me a bit. I'll start here, and I'm going to come around. I'll anchor the band. 50-50. So 50% tension, 50% overlap. I'll continue up the arm. How you doing? Not panic you about this. So I've got a compressive force being applied to those tissues. So everyone says the pain's here. Why are you putting it here? You understand there's nothing local about these fascial lines. When I manipulate these fascial lines, things change above and below. There's nothing localized about the effects. I'm going to bring this underneath. I'm not going to go into the axillary fold. I'm not going to go into the armpit. I'm going to come over here and I'm going to traverse this way and tuck in the band. Okay. The first thing I can do, and if you do joint mobs using this band as an adjunct, you can get great tissue capture. So I'm simply going to distract the joint and move her through positions of internal and external rotation. What's happening right now is the tissues are being forced under the compression to glide over each other. It's a forced, I call it a forced ART. I'm an ART guy. But it's a wonderful way to start to create some external glide on these tissues. I can then start to do some internal glides by having her move. So I'm just going to have you press up overhead and come back down. Come here, move your shoulder in an external rotation and internal. This is an internal glide. And then I can add to it. Watch. She comes in external rotation. I can stack a fascial glide. Look. Is it painful at all? I'm just going to have you come into abduction overhead. 2-minute window. Leaving it on for more than 2 minutes does not amplify the effect. Good? Okay. Strategy 1. Tape is a reinforcement strategy. None of the things I'm showing you are going to detract from what you do as a therapist. This isn't all I do. I'm an RMT. So I do ART, I do acupuncture, I do everything. This is an excellent complement. Look, your longevity is going to be predictably affected by your ability to transition through tools that you build in. If you do this all day, it's going to be a short career. So here's the last piece with tape. Let me explain tape really quickly. How much time do I have? Good. I'm not taking tape to pull a joint into position. If someone tells you that, they're crazy. You can't use tape to put a joint in the right position. Joint centration and the position of a joint is affected by neurology. If I provide the brain with better information, it's probably going to give me some length-tension relationships that are a little more functional for the joint. So when I apply tape, I'm reinforcing. Applying tape, 3 things. It's always neurosensory. I'm using this to tap into this platform. Skin and the brain are intimately connected. I'm just using this to reinforce that effect over time. Rock tape will stay on for 5 days. That's what I want. Secondly, there's a decompression of tissue and the decompression of that fascial system by virtue of tape when I put it on. More space, more glide. And then lastly, creating shear on those tissues as I drag the tape is affecting the shear point of those underlying, that connective tissue matrix. It comes back to the Longevin study. If it lacks glide and slide and the fascia is densified, the messaging is faulty, pain is inevitable. So here's what we're going to do with tape. You can have you stand right here. So to avoid a reaction to tape, simple. First of all, you'll see rounded. Why? Yeah, if sharp corners is going to get caught in bedding, clothing. You don't want the tape to come off. If someone puts tape on you and the next day it falls off, I'm questioning the effect. So the way that we avoid potential risks or irritation with skin is simple. I'm going to stretch the person, not the tape. Okay, right here. The back part of the shoulder is stretched. You can just put your arm right there. So I'm going to start bottom up. Can I start top down? Direction of tape doesn't matter. It's ridiculous. Okay, I'm taping as fast as I can. Bring this right behind. Is that okay? This is only one way to tape the shoulder. There's many ways to do this. It depends on what I see. Here, you just put your palm forward, and I'm just going to come over top. So this is a decompression strip. So I'm coming over top of the joint. It's going to create a lift on that joint complex. So simple strategy to reinforce this. Then all this work. She leaves, what now? The tape's going to mitigate some of the pain response. It's going to provide a bit of change in the centration of the joint. Her brain's getting great information. It's going to grant me a little more. What's the last piece of the puzzle? Homework. She leaves without movement. We've improved her mobility. If we let her go without anything to reinforce it or potentiate it, that's a miss. Our job is to facilitate better motion. We've just given her a better adaptive platform on which to operate. The tape's going to reinforce it. Sit there. All right, please. Very rude. Put your arm here. Come overhead. It's a little better. Extension's good. We still have a forward carriage, but I would affect that through some soft tissue intervention. But these as tools are excellent complements for you guys to build into your practice. All good? Perfect.